My name is Temiloluwa Faokunla, and I'm a fourth-year medical student at the Medical College of Georgia. Today, I'll be talking about cervical cancer and screening recommendations. So, what is cervical cancer? Cervical cancer starts in the cervix, which is the lower part of the uterus that connects to the vagina. This cancer develops when cells in the cervix change and grow out of control. These changes often begin as dysplasia, which means precancer, as some cells look abnormal but have not yet become cancer. If these abnormal cells are not found and treated, they can become cancer over time. The main causes of cervical cancer is due to an infection with certain types of human papillomavirus, also known as HPV. HPV is a very common virus that spreads by sexual contact. Approximately 80% of people will be infected with HPV during their life, but in most cases, the body clears the infections on its own. Sometimes the infection remains, leading to changes in the cells of the cervix that may turn into cancer in later years. There are two main types of cancer. There's squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma, this is a type of cancer that starts in the thin, flat cell lining in the outer part of the cervix. It is the most common type, making up for about 70 to 80% of cases. Adenocarcinoma, on the other hand, is a type of cancer that starts in the glandular cells that line the inside of the cervix. It is less common, but has been increasing in recent years. Most cervical cancers are caused by high-risk types of HPV, especially types 16 and 18. These types are more likely to cause long-standing infections that can lead to cancer. Other risk factors include starting sexual activity at a young age, having multiple sexual partners, smoking, and not having regular cervical cancer screening, like pap smear or HPV tests. So, what are the benefits of screening for cervical cancer? Cervical cancer screening will help reduce the risk of developing and dying from cervical cancer. Screening can also help detect cervical disease at an early stage before symptoms appear and when there are more treatment options. Cervical cancer found at an early stage is usually curable. How to prevent cervical cancer? There's HPV vaccination. So the American Cancer Society and other expert groups recommend starting vaccinations at ages 9 to 12. The preferred regimen is 2 doses given 16 to 12 months apart for those starting before age 15. For individuals initiating vaccinations at ages 15 to 26, 3 doses are recommended at 0, 1 to 2 months, and 6 months. Vaccination is absolutely the most effective when administered prior to exposure to HPV, and its use is projected to prevent over 90% of precancer changes and cancer of the cervix. Vaccination is also recommended for all individuals regardless of sex, and catch-up vaccination is advised through age 26, if not previously completed. For adults aged 27 to 45, vaccinations may be considered based on shared decision-making, but the public health impact is greatest in younger age groups. Regular screening tests is also another way to prevent cervical cancer. The American College of Obstetrics and Gynecologists recommend cervical cancer screening beginning at age 21 for all women and people with cervix, regardless of sexual history or HPV vaccine status. For those aged 21 to 29, screening is done every 3 years with pap tests, also called cytology. For those aged 30 to 65, screening options include pap tests every 3 years, an HPV test every 5 years, or both tests together, co-testing every 5 years. Screening is not recommended for people younger than age 21 or for those who have had their cervix removed for reasons not related to cancer or precancer. The HPV test detects the virus that can cause abnormal cervical changes. The pap test screens for abnormal cells that may develop into cancer if not treated appropriately. And another way to prevent cervical cancer is follow-up treatment. If screening test results are not normal, you should go back to your doctor for appropriate follow-up treatment when needed. These tests can be done in the doctor's office or at clinic. And just some more ways to prevent cervical cancer include avoiding smoking, because smoking does increase the risk of cervical cancer, especially in people who have contracted HPV. There are chemicals in tobacco that can damage the cells of the cervix, making it harder for your body to clear HPV. Using condoms during sex can also help prevent cervical cancer, as condoms can lower the risk of HPV and other sexually transmitted infections. While condoms do not provide complete protections against HPV, they do reduce the chance of infection and may help prevent cervical cancer. Getting screened early and regularly is another way to prevent cervical cancer. Early and regular cervical cancer screening is one of the most effective ways to prevent cervical cancer. Seeking reliable information is another way to help prevent cervical cancer because relying on trusted sources such as healthcare providers, American College of Obstetrics and Gynecology, American Cancer Society for up-to-date and accurate information about cervical cancer prevention and screening can help. If you have questions about cervical cancer, HPV, or screening, talk to your healthcare provider. Early detection and prevention are the best ways to stay healthy.